Hello, everybody. My name is Mackenzie Flynn. I serve as the co-chair of the YARR Policy Committee. I'm an undiagnosed patient, and for the past 6 years, I've directly seen the costs that rare diseases can have. On my journey through the diagnostic odyssey, I've been misdiagnosed several times, and with each new diagnosis comes more tests, often repeat tests, new appointments with specialists, and more traveling across cities and in some cases even across state lines. I've also experienced other indirect costs such as education accommodations and productivity loss. As you can see, there are also non-medical costs and societal consequences for undiagnosed and untreated rare diseases. For one, there's medical foods. There's also transportation, which across cities, states, and in some cases across the country, to see medical specialists or get specific tests done, etc., can be very expensive and also very timely for rare disease patients. There's also time out of work and/or disability, as in some cases that can lead to a loss of income. And there's also the cost of living, as home or vehicle accommodations and insurance coverage differences and difficulties can be very costly and sometimes take a long time to implement. Proposals to lower healthcare costs have largely focused on the pricing of existing therapies, and the discussion rarely covers the cost to society of not diagnosing and treating patients. The overwhelming cost of the taxpayer, the economy, caregivers, and families, as well as individual patients themselves, needs to be further examined through a comprehensive study. And that's how the Burden of Rare Disease Survey was born. The Every Life Foundation for Rare Diseases, in collaboration with the rare disease community, has worked with health economists to develop the National Burden of Rare Disease Survey. Language was included in H.R. 1865 and passed into law in late 2019 to require the Government Accountability Office, also known as the GAO, to conduct a study on the economic cost of untreated and undiagnosed rare diseases. So when it comes to what the Burden of Rare Disease Survey is, the Every Life Foundation's Burden of Rare Disease Survey has the goal of determining the true economic cost of rare diseases. In order to do so, the study examines 3 different cost areas, including direct costs, such as direct medical costs, indirect costs, such as a loss of productivity, as well as non-medical costs like home accommodations, education accommodations, and personal caregivers, etc. You should take this survey if you or someone in your family has a rare disease, you are familiar with your family's finances, and/or you know your family's rare disease-related healthcare needs. This study will enable us to increase public awareness of the public health crisis of rare diseases so that we can better inform policy proposals that impact the rare disease community. The results will also be published in a comprehensive study and will be a powerful tool for all rare disease advocates. Holistically, there is a dire need for a comprehensive analysis defining the true prevalence of rare disease in the United States and evidently the resulting costs. Understanding the causes behind these costs will support Congress, the administration, important stakeholders, as well as the private sector, develop effective policies and tools to reduce this burden on the economy, to taxpayers, the workforce, as well as patients and their families for decades to come. We want everyone and every voice to be counted in this groundbreaking survey, so if you're interested, please complete the survey as soon as possible. Thank you, and that's about it for me.